Okay, good morning, everyone. Thank you for joining our webinar. My name is Morgan. I'm going to be facilitating the meeting. Um, Today's topic, we are going to talk about TRAGER Approach with Roger Hughes. So first, I want to start out by talking about a little bit of who I am and my relationship with Roger. So Roger works at Shen Health and Harmony, and I worked there for about 2 years. So I did work with Roger, and during that time, I received a lot of TRAGER Approach from Roger. And to this day, I still get treatment at Shen, and I'm still working with Roger. TRAGER Approach is something that I feel at this point is an integral part of my life. And so I'm really excited that I had the opportunity to experience that and get to continue to work with Roger. So yeah, now time to introduce Roger. Roger, tell us a little about yourself.
Thank you, Morgan. And I am being heard, I take it. Yeah. Just want to make sure. Yeah. Thanks, Morgan, for holding the space for this webinar. I'm Roger Hughes, and I'm a TRAGER practitioner and instructor. And I've maintained my practice at Shen Health and Harmony since 2005 when they opened. I'm also a licensed massage therapist in the state of Illinois. And TRAGER has really become part of who I am in my personal life. And it's something that I bring into my professional practice every time I'm with a client. It continues to enrich me in many, many ways. And this is what excites me. I get to share this kind of approach, this somatic approach with my clients.
Thank you. So I guess one of the first questions, and I'm sure you get this a lot, when we're talking about body work, a lot of times I think we envision massage, right? Like a deep tissue or Swedish massage. So, in your own words, what are some of the differences between a typical deep tissue or Swedish massage and TRAGER approach?
So I was initially trained as a massage therapist 28 years ago, and I did that work for a number of years, and then I found TRAGER. So I don't really practice standard or traditional massage anymore, but I can say that work is more treatment oriented, I think, where somebody comes in with a specific need, pain, or condition, and there's a treatment that then follows course. In TRAGER, it does have a therapeutic effect on what people arrive with. But I would say the main difference is that I'm actually working with the person. I'm working with their nervous system. I'm meeting them exactly where they are. And perhaps the biggest difference is that there is no discomfort or heavy pressure or so-called therapeutic pain during the session. You know, it's not something that requires a focus on receiving uncomfortable pressure. It is more about helping people feel themselves through the touch and the movement that I provide so that they can actually recall that sense of lightness, that sense of spaciousness, sense of maybe experiencing something that they might have forgotten about in terms of how they can actually be in their body. So it is more, it's experiential, and it's based wholly on their feeling experience.
Yeah. So could you give me some examples of common goals? Or I don't know if that would be the right term, but when someone is coming into a session with you, um, what are some, yeah, I guess common goals, but if you have another word to use.
I like that question. I don't think anybody's ever asked me that question, but common goals. Common goals would be initially to create a space of safety. That's every single time. So whatever people show up with, I get a sense of where they are in their own safety of their body or their mind. And I do my best to assure them of what their role is in the session. In other words, putting them at ease and really listening to what it is they're wanting. And they may not know, but that dialogue initially is actually the beginning of the session. You know, they may come with expectations. They may be there not even knowing what to expect, but it's always my job to create a space of safety, because this is where their nervous system will receive potential positive influences that they can recall later on.
So then, what are some common reasons people come to see you? Would it be physical pain, emotional pain? Can you give some examples of different types of people that you've worked with?
Sure, it's pretty wide and broad, I would say. Uh, Pain that's been around a long time. Um, Pain of mystery, the mystery of pain. They don't know what it's from, what might have prompted the pain. Certainly, mental weight, just life bearing down on their bodies. It may even be curiosity about this other approach. And certainly, I get a handful of referrals from people who've received the work already. But I would say mostly folks who are looking to drop their old pattern of pain. They're looking to have a repatterning of sorts in how they move, maybe even a repatterning of their relationship to pain, their relationship to their body. And I love helping folks appreciate their body more as a resource, as a regulatory resource. And that's really what Traeger can do over a course of a few sessions, is you begin to rely on the strength and the resiliency of your body rather than something that is looked at a little differently.
I really like that reframing of how we like the relationship with the body. I feel like a lot of times in maybe more traditional medical fields that at least this is my experience going into this is something wrong with my body. I need to fix something that's wrong with my body. And that whole framework is putting these ideas that whatever my body is telling me is wrong, and that I am something that needs to be fixed. And it can even go into this like perfectionism of I should feel no pain ever or whatever. And so that is something that I really like about Traeger is my body's telling me something and it's important to listen and I need to work with my body rather than against it. And so I really like that reframing. What was your experience the first time you received Traeger? Because you're coming from a traditional massage bodywork field, and now suddenly, you know, you really only do Traeger approach. So there must have been something that really resonated with you when you experienced it.
Sure, and that happened a lot. But I would say the first thing that really caught my attention, I had a lot of neck tension early on in massage school and later as a massage therapist. And I remember when I would have to approach somebody's neck in massage, my own neck would stiffen up. And I just sort of, push my way through it. And my first experience, there were a couple of them, getting on the table and receiving a Traeger session. And I remember the practitioner moving my head and my neck around, and I was just flabbergasted how there was no pain, there was no stiffness. They were able to move me freely with support and connection into my body, and it felt really secure. It just felt real to me. So that has stuck around a long time, and a lot of people come in with this, I think, same kind of notion. This is this thing that I've got, but it's the touch that can begin to break through, and I use that word lightly. It can begin to soften through these long-term areas of stiffness and holding and armoring and unconscious gripping, because it is informed touch. It's touch that allows them to feel how they can feel.
Well, I really like that too, because it feels very collaborative. And then it also, what you're saying brings up something for me of how it's not just about the physical body, it's also about that emotional, spiritual body. And so something that I've personally experienced in Traeger that I'd love for you to touch base on is how it's not, it's so well rounded in this fact that it's not just that physical piece. I've gone to you for a lot of different ailments, right? My neck, my shoulder, my knees, whatever. And I've also received work from you for when I'm not sleeping well, I'm feeling really anxious, or my body's not feeling safe. And so I even, like, one of the most beautiful moments I remember in a session with you is you held my head in your hands and I just started sobbing. And so it was that moment where I realized that this work is so much deeper than just addressing the physical body, which I love standard massage, huge fan. And I also feel like there is this space for both. So can you talk more about that emotional aspect of Traeger and maybe working with people who might have anxiety disorders, depression, trauma, things like that?
Yeah, and I would say that you probably heard this in one form or the other, that our bodies are simply a reflection or manifestation of what's happening in the mind. So this is really a way of influencing and giving the mind a clearer interpretation of what's going on, whether there's some underlying thing in the mind that's not feeling safe. So giving the body a sense of contained support, sense of, at the same time, a sense of expansion and permission to feel a little more open, speaks right to the mind. It's also, Milton Traeger said that as soon as you touch the skin, you're touching the mind. So I know that, and so I approach that with that intention in my mind. So it's really simple, but can be quite profound. And I would also say, I would describe it as sort of dismantling the scaffolding around conscious tension or conscious pain. When I go in and I begin to touch, or even in an interview, I begin to give support for that part of consciousness, that part of that person's body, to feel at ease, to soften the edges around all the stuff that's gotten attached to this one thing that they're coming in with.
So for someone's very first session, say they're used to receiving traditional massage, and they're coming to see you for Traeger for the very first time, what is something you would like that person to know?
Well, they can choose to wear clothing. That's not a requirement, that like in massage, where people are partially disrobed and covered with a blanket. So that's a nice little piece, I think, for a lot of people. They can expect to maybe come in with an intention, just a simple intention. I want to feel this way in my body. I want more of this sense in my body. And from there, we can begin a process of exploring what that feeling of being more centered, being more alive, being more at ease, or being a little more lively in the body. I would say also I tell new folks is 3 sessions initially, like maybe a week apart from each other, is a good general framework, because it is a different process. It's a different language, and it's a opportunity for people to begin the exploration of feeling themselves. And that takes sometimes a little bit of coaching.
Absolutely. And that resonates with me with the last session that you and I had. I think a lot of times when people visualize a session, it could be laying down. However, the last session I received, we started off standing and walking around the room. I wasn't ready to, my body wasn't ready to just lay down and be calm and soft. I was in a space where I needed to be a little more active, and work myself into a space where then I don't like to use the word relax. I like the word soften, to just soften and be in the moment a little bit. And so that's something that I really think is cool about Traeger approach, is that it can look like so many different things. And there is actually a point where I feel it's so collaborative that I have the agency to guide a session, and tell you what I feel my body needs. But that takes time of learning sort of what I need and how to speak up for myself in what does feel good, what is causing pain, what am I interested in exploring movement wise. And I think that's really beautiful. So wonderful. I want to open up for questions. You're welcome to unmute yourself and ask the question. You can put it in the chat. Anything that pops up for anyone.
So I don't see any questions, or maybe I'm missing that. Is there anything going on there, Morgan?
Is it Jillian?
Yes.
Yeah, go ahead. What's your question?
Um, Roger, I've had sessions with you, I think starting before you, when you were like a traditional massage therapist, and then after when you've had your full Traeger. So I've experienced both sides of it. And I've really gotten a lot out of listening to you and Morgan sort of delve into what you think is happening. And I would say one of the things you have been teaching me is the language of my body, that it's I think, Morgan, this goes to your question about what's the emotional or spiritual side of this. And I feel in the work we're doing, it's I mean, there's words, and we have some words in the beginning. What's my intention? What do I want to feel? But I feel the session goes into a way of me learning about my body and how it speaks to me so I can live in it more peacefully or softly. And I guess I find myself always saying, what am I learning, or kind of where is it? And it's not in words as much as something else. I can't quite put my finger on it. But so, Roger, if I were to ask you, what is this language I'm learning? What is it?
That's your question.
Yeah, what am I learning?
Yeah, what is it? I want to go back just slightly to what something Morgan said, and I'm going to try and answer that. A lot about what happens in a session is just arriving, continually arriving, layer after layer after layer, deeper and deeper and deeper into our bodies, into our body's intelligence. And so that language, Jill, the work that you and I have shared, language is how you are interpreting, I think, what you are experiencing in your body. I think you are kind of a wordsmith. So it's different for each person. Some people are more kinesthetic. Some people are more connected to movement. Some people need words. But there is a collaborative thing that runs straight through every one of these sessions. And it's giving equal say or equal power to the person I'm working with. It is definitely a partnership, a collaborative process. And that's one of the big differences, I think, in this work as a somatic approach in comparison to traditional massage, where the power differential is more clearly defined as somebody receiving work and somebody giving it. Here it is my job, my passion is to follow the person who I'm doing the work with, who has come to receive the Traeger approach. So it's a language. It's an opportunity to have a conversation about, oh, how my leg feels compared to the other leg, right? So we use a lot of comparisons in terms of sensation as we work through a body. And that the brain really loves to have comparison, because then it can say, well, my left leg feels much better than the right. So then we have something to chew on, to actually work with. Anybody else?
That's a really good question, Jillian. Something, I don't know if this has been your experience, but occasionally I'll have like a revelation. And for me, it does come in words, occasionally. And one of the coolest experiences I had in Traeger that still sticks with me today is that I don't need to change anything about who I am. I just need a little bit of support in being who I am. And so then it was sort of figuring out what type of support I needed. And in that moment, it was physical. But then it opens this door for, like in my day to day, like what does that support look like? And so it's cool how it can start out as one thing, right? Like, oh, my legs feel different from each other, and sort of weighing this, like, what do I want to feel? But then it can travel into the day to day, which is something I really like and I think is amazing.
I'd like to speak to that a little bit, because this was one of Milton's gifts, was this real practice of recall. And what that means is you experience a particular feeling in your body in a session. And then as a practitioner, one of the things I do is I coach and support that person to recall the feeling experience later in the day. And now, with all the studies on neuroplasticity, positive neuroplasticity, we know now that that's a real thing. So the more you recall a pleasurable, wonderful, easy, spacious sensation in your body, the more that gets developed in the connections in the brain, and you are more easily able to dial into that in your day to day.
Does anyone else have questions for Roger, or even comments on your experiences if you've received Traeger? Feel free to just unmute and you can ask, or you can throw it in the chat.
It could even be a silly question.
Oh, well, heck, I can ask. Oh, sorry, Tiffany, go ahead.
Oh, you
You
go.
said silly question. I was going to jump on that.
Yeah,
No,
me
go
too.
ahead.
Me too.
Oh.
I'm good with those. No, you start first.
I mean, I was just going to mention my experience with Traeger because I love it. I really like kind of what I was doing. I was taking notes. Really, what I was comparing was some of the things that Roger was saying, keywords, and then kind of tying that into the experience. So, and then kind of framing that into, my own interpretation of how those things could potentially relate, in addition to taking in your interpretation. So, I did love a quote that was mentioned: when you touch the body, you touch the mind. I felt that instantly when we were doing a session. I could feel the intention. I could feel every single thing that you were doing. It didn't feel like pre-planned or premeditated, but it felt very on purpose, very deliberate. And I noticed that right away. So, but I would say, if I had to leave like a raving review, what I felt from Traeger was a lot of space. I felt more ability to be free in my own body. The range of motion had increased, but even if I wasn't moving, I could feel that the range of energy in my body had increased. So, comparing that to my normal day to day, and then recalling that, once you kind of get a taste of it, especially throughout the day, recalling it throughout the day, and then feeling that feeling again and again. I mean, that's an amazing thing. And there's not too many practices or things that I've been exposed to that does it quite as well as the Traeger approach did. So, yeah, raving review. No stupid questions, I guess, or silly questions.
Thank you, Ernest.
Thanks, Ernest. Tiffany, go ahead.
I was just wondering if you like also treat children, or like, I guess maybe a two questions, but like if you treat children as well, and like if you have like a favorite type of client, like that for you is rewarding.
Yes, I have over the years worked with children and even little toddlers, and they come in with a parent, of course, all the way through, teenage age. Yeah, it's just having the conversation at their level. And a big part of this work too is the principle of playfulness. That engages the mind tremendously when you're not so serious about something, right? your second question was, again, what was it? A more typical, what was your,
If you
repeat
have
your,
like a favorite like type of client for you that feels very rewarding to treat.
I would say somebody who comes in with a lot of curiosity about discovering more about their body. So that could fall under the, the tent of something that they want to get rid of, a pain, a pattern that they've noticed in their lives that they're ready to drop. But somebody who's not willing, but somebody who's available to actually work in partnership, and maybe with the intent to feel more comfortable in their body, to live more comfortably in their body. And that's not to say that very specific things are addressed with Traeger as well.
I will say though, living in the body is a lot more difficult than I think it might sound. I feel like I remember my first few Traeger sessions, and I've let go a lot of this, but all I want to do is have you tell me what I'm supposed to be doing in the session. And you don't. And so that's part of, I think, my personal maybe power struggle in the beginning is, well, I just want Roger to tell me what I'm supposed to be doing, and I want Roger to tell me what he thinks is wrong with me, or all of these things, and I don't get that. And so that's directly challenging a lot of maybe that's like a pattern in myself that I've had to let go of, and by doing that, then I am in my body, because I know that you are not going to give me direction, and I'm going to have to do that for myself.
Yeah, sometimes it is a little bit of a challenge for people in this country with that conventional thought that, oh, yeah, I'm the expert. I am an expert in Traeger. And it's a process. It's just a process of developing receptivity around areas in your body that may have been a little dormant, or there's some murkiness around feeling better. It could be so many things, but it's this coming together and having some time to share, I think, on a very not intimate, but a close and safe dialogue where things can really begin to, again, I think I said earlier, have permission to express what it is you're feeling in the moment, because you can only feel in the present moment. And that's essentially what we're looking for.
I have one last question if no one else has any, but again, feel free to just jump in or put it in the chat. Mine's more of a logistical one. So say an individual is receiving typical massage or acupuncture, physical therapy, seeing their orthopedic doctor, and they are ready to try Traeger approach. What is your suggestion for sort of balancing all of those things out? Can they all be done in conjunction with each other? Would you prefer them trying one type of service alone? I'm not sure if my question is making sense, but a lot of times we're seeing a lot of different practitioners. So what is your recommendation on experiencing Traeger?
Yeah, that question's a good one, and especially at Shenzhen, having worked there for many years. And my real sense about that is new people that they come in and receive 3 sessions without anything else. That's pretty usually the case because it takes sometimes a few days, a sort of lag time for the body to really sort of digest or integrate a session. So if something else is coming in there, it makes it much more challenging for the person to know where the benefits actually came from. The other thing I would say to that is I've guided people to be really mindful about the size of their healing tribe. Too many, cooks in the kitchen. It makes awareness of what really is helping you, how your body's helping you. It makes it really harder to figure that out. And that's been something I've mentioned many, many, many times. People are so desperate. And then here comes along the Traeger approach. And I'd like to sort of have a little more space around it, I guess.
Absolutely. That makes a lot of sense. So if there are no other questions, I'd love for us to move into 5 to 8 minutes of experiencing some Traeger. Feel free to keep your video on, turn it off, whatever you're most comfortable with.
And I'd like you to just imagine that weight going down into your feet. Just letting your mind go down into your feet. Yeah. You might even be feeling the floor reaching up and supporting underneath your feet. It might be more of that kind of thing. But even as I talk about it, I'm more in touch with my feet touching the ground. And if you're sitting, I'd like you to imagine that you have the extra pair of feet right at your seat, at your sits bones, the bones that you're actually sitting on, and begin to bring equal attention to those sits bones. So you have your feet and the feet in your sits bones. And you're maybe beginning to shift your upper body a little bit. It might be side to side. It might be forward and backward. The forward and backward may begin to bring more evenness in distribution of support between your feet and your sits bones. Maybe there's suddenly curiosity about your rising spine, or a piece of maybe heavenly gravity drawing your structure upward as you're grounded in your feet and in your seat. And then you can begin to explore maybe a little more circular movement with your torso from your waist. Open your eyes and maybe let your eyes guide your movement. Go back and track your breath. What's happening to the breath now? How's your breathing maybe being ushered by your movement? Yeah. Notice the room you're in. Has anything changed from 5 minutes ago when you arrived and we started this little exercise? Is your gaze a little wider, a little clearer? You may be seeing from your body. Is there a more sense of taking your view in? Yeah, and just to sort of bring this to a close, as you let movement slow down, the movement in your body slow down, the movement in your mind slow down, is to now check in with where you feel weight. Is the weight become more saturated? Is it lighter? Do you feel more somehow whole? Your breath easier, fuller? I invite all of you to play with this later today when you're at your desk.